a new business model for health maintenance, financed by lowering significant public health risks, sick leave times, and overall health costs through digital platforms supported by artificial intelligence, AI, a digitally managed checkup, sustainable telecoaching and telephysician process, seasonal vaccinations, quick care services in order to lower risks of chronification. The sole purpose of the CareCenter is health maintenance. In addition, it is a quick link to care services when the client is in urgent need. The client is guided interactively through his individual checkup. The most important health data are recorded efficiently in the shortest time possible. The No ID code concept complies with the highest international data protection standards. The client retains full ownership of his health data. A checkup begins in the life station. The client is examined three-dimensionally using a light topographic, non-invasive unit. At the same time, body posture, body weight, and body measurements are assessed. The body mass index and the waist-to-height ratio are calculated from this information. The customer can then check his eyesight himself. In addition to an interactive anamnesis, color vision, stereo vision, and the central field of vision are verified. The overall state of health is checked in 30 minutes while sitting inside the preventiometer. Blood pressure and oxygen saturation are measured simultaneously. One drop is enough to determine many important blood values in just minutes. While the 12-channel resting ECG is being performed, a stress analysis in HRV format is read out. This is followed by the hearing test. In addition, the lung function is examined. The vein test and the carotid intermedia measurement are performed. The bone density is screened via the heel of the foot. The CareCenter is always supervised by a doctor who bears the responsibility. The determination of the driving fitness of professional drivers is followed by a skin examination. In case of abnormalities, the TSH and PSA blood values are tested. All collected health data is stored securely. We have selected the IBM Electronic Health Record as the secure repository for all data that belongs solely to the customer. The client may access his electronic storage at any time. He may release selected data to his telecoach, teledoctor, his family doctor, or specialist. In addition to the storage space, the customer or the telepersonnel receive digital reports. The Vilua Salesforce platform is the cockpit for telemedicine. The telecoach uses the cockpit to monitor the coaching process, access data analyses, and save results. He can assign appointments, and he can communicate with his customers via chat, audio, or video. The teledoctor uses the cockpit in order to discuss health scores provided by the checkup. He may advise his client effectively and fast. He can order further analyses and always views his client in his overall health condition. The teledoctor can communicate with his client via chat, audio, or video. The smartphone is the information platform for the coaching process and for medical data. In the first face-to-face coaching session after the checkup at the CareCenter, the customer loads the Vilua Smart app to his mobile phone. Via his own smartphone, the client has protected private access to his telecoach, his telephysician, his individual e-coach elements, and his personal health maintenance records. A push note will inform the client in time for his next teledoctor or telecoach appointment. CareCenters already exist in Paris, France, Rochester, USA, Greifswald, Germany, Braunschweig, Germany, and are coming soon to Berlin, Germany, and 15 new locations at German clinics, to Riyadh, Saudi Arabia, and to Dubai in the UAE.